Hey everyone, Andy here. I'm on my beautiful green bicycle just outside Brighton Seafront where I live, there's the sea, and I'm going to meet a woman called Chris Brown who helps people prevent suicide. I'm really keen to speak to her because suicide is something that we don't talk about very much, but almost everybody's been affected by it at some point in their lives. I think rather like spotting mouth cancer in a patient or spotting tuberculosis, it's not something you're going to come across every day, but when it happens, be really good to know what you can do about it. It could be the most useful thing you do ever. So it's about 3 or 4 miles away, so I'd better get cycling. I'll set off and I'll see you there in a bit. Okay, here now, quite hot. I must stop wearing so many clothes. What is it with me? I always wear too many clothes. Anyway, I've got to the top of the hill and I'm going to pop in and see Chris. Cheers. Hi, I'm here now with Chris. Almost everybody knows someone who knows someone who's been affected by suicide.
I mean, that's right. We know that in any 12-month period, 1 in 20 of us are going to have thoughts of suicide. However, there's so much stigma and taboo surrounding suicide that we might find it very difficult to tell other people about, so we might suffer in silence.
Chris, around patients, if you're like a doctor or a dentist, what kind of things do you need to look out for? There should be like a red flag that's a sign that this could be an issue, and what would you suggest that they do?
Okay. I guess if you are seeing a patient, if that person's struggling with thoughts of suicide, you may notice things like that person reporting an increased number of physical health complaints, maybe quite common issues, problems with their sleeping, with their libido. They might talk about depression. Someone might start to abuse alcohol or drugs, or to use them more heavily than they have done in the past. Someone might talk about not being able to go on anymore, or saying that they just can't take things anymore, or you might just sense that someone's desperate or feeling worthless or hopeless.
So there's no one single sign that's always a red flag, it's more the overall picture or a sense.
Yeah, exactly. It's not as straightforward as saying that suicide is a disease or an illness with a certain set of diagnostic criteria. Any of those things I just mentioned could be a sign that someone's thinking about suicide, but also they may not be.
And if you're having a conversation with someone in an appointment, and if you're a GP, you don't have much time, if you're a dentist, you've got other things to be getting on with, and you just get that sense that someone, you think, you know what, I'm really worried about this person.
Yes.
What should you do at that point?
Okay, if what you're hearing from someone is enough to give you the sense that this person might be struggling with thoughts of suicide, then ask. You might want to say something like, sometimes when people are very depressed, have started drinking a lot and are feeling very hopeless, they might be thinking about suicide, and I'm wondering if that's what's happening with you at the moment.
Okay, so just breaking through that taboo, breaking through that sort of barrier.
Yes.
And you were saying before that it's almost like sometimes people in their behaviour are inviting the question, but they don't actually want to say themselves.
Yeah, and they might be inviting you consciously or unconsciously. If they say yes, okay, then you know that suicide's on the table and you need to talk about that. If they say no, good, you can still help them, and at least they know you're the kind of person they could talk to about suicide if they were struggling.
If it ever came up, if we move on to thinking about colleagues, if you're worried about a colleague, it's important to get through that taboo as well.
It is.
But you don't jump straight in, right?
Yeah, I think depends very much on your relationship with a colleague. There might be some people that you've known of old and with whom it's easier to say, I'm really worried about you, I might be way off. But are you thinking about suicide? Exactly,
With people, there's not like one single sign, is there? People don't walk up to you and say, I'm thinking about
Not
committing
very often.
suicide, do
Not
they?
very often,
They tend
yeah.
not to do that. And after them, if someone has committed suicide, people are usually very shocked.
Yes.
Initially, they're like, "Well, I didn't see that coming." This
Very
is their
much
first
so.
response,
Yes.
because people might be sending out subtle signs,
Yeah.
inviting the questions, but then
It
if
doesn't
it's
come.
never asked, then they never get a chance to do anything about it. I mean, obviously, in healthcare, with very stressful jobs and hearing other people's problems all day, suicide is a problem amongst dentists, among doctors too.
Yes, it
And
is.
so, if it's yourself, and what should you do if you find yourself thinking about suicide a lot?
Well, we know that to have thoughts of suicide is to be human. So, I'd say be kind to yourself if that's your experience, and get help. There are people who can help. Help people. Yeah, not just one person. Talk to people you trust. Talk to people that can help you to stay safe.
Yeah, and you're sort of breaking through that taboo again, isn't it?
Yes.
The sort of stigma. Like, I'm allowed to say I've got a headache, but I'm not allowed to say I'm thinking of committing suicide.
Yeah, absolutely. And we live in a culture where suicide has been seen as both a crime and a sin against God. So we can help break down the stigma even by using language like someone has attempted or died by suicide instead of talking about committing suicide, which you commit fraud, you commit adultery, you commit murder, but we're talking about a human condition here.
Yeah, it's a normal thing, isn't it? Part of being human is to
sometimes life gets a bit
much. And so essentially you say if it's you, speak to someone.
Definitely.
Yeah.
Yes.
This is it's an opportunity to save someone's life, which is not something you can do every day.
Certainly.
Yeah.
In the same way that you can learn CPR skills, physical first aid skills that can help someone to stay alive till professionals arrive, you can learn suicide alertness or suicide intervention skills that could absolutely help someone to make a choice to stay alive.
Yeah, and you have a video of people who've exactly had that experience.
Yes, we do. A few days after we released this video, we had an email from a young woman in America saying that she was alive because she had watched our film and decided not to suffer in silence but to reach out and talk to a friend about the thoughts of suicide she was having. So talking can
well, it's a great video,
lives.
Isn't it? It's a great video. Lots of little clips of people who are telling their story about how they were thinking of committing suicide, but then their lives were turned around thanks to a moment's intervention by someone who was in the right place at the right time.
And I would just add to that, as healthcare professionals, you're particularly well placed to make this kind of intervention. We know that in the few weeks before their deaths by suicide, a large proportion of people have gone to talk to a healthcare professional such as a GP. So those few words you say could make a huge difference.
Yeah.
Thank you.
Thanks. That's great. That's perfect. That's fine.
Fantastic.